Earlier today, I had an opportunity to speak to Dr. Zameer Brey. Zameer has been working in and around the COVID pandemic for the last 2 years. He's an expert in public health, and he has, as you'll hear in the interview, he has a background in looking at healthcare systems. And I got an opportunity given to me by the Solidarity Fund to just ask some of the questions that I've had on my mind about the COVID pandemic, and especially about how the business community can step up to contribute towards making sure that we try and get our economy going again, get back to whatever normal is going to look like after COVID. And well, I enjoyed the conversation. It went on longer than we planned, but I hope that you will enjoy it too. Some fascinating insights, fantastic data, one or two stories that will really get you thinking, and ultimately a strong focus and a strong takeaway point that not only should we get vaccinated, but we should enable and help people in our community, in your businesses, in the environment that you find yourself, help them to get vaccinated. So without any further ado, here's my interview with Dr. Zameer Brey. Dr. Brey, thank you so much for your time. It's lovely to speak to you. A few weeks ago, I got an email from my medical aid, a private medical aid, and I've got a few friends who work at other medical aids and are trustees, and they all saying exactly the same thing to me, that the unvaccinated people who are getting COVID, they're filling our hospitals. People who are vaccinated, they might still get COVID, but they're not getting sick, they're not getting into hospital. Do we have public sector data on the effectiveness of vaccines in South Africa? And are we seeing similar things in the public sector?
Yes, thanks, Graeme. Thanks for the opportunity to just chat about some of these issues. And you ask a very important question, because as we know, the public sector actually deals with majority of the population. But in this particular instance, glad to report, Graeme, that the picture is equally as optimistic. And so pretty solid data that was shared by the Premier of the Western Cape a couple of weeks back basically demonstrates that less than 10% of infections during the third wave were among individuals that were fully vaccinated. And I'm particularly focusing here on the over 50s because we know that's where the highest risk is. Less than 5% of admissions were in those that were fully vaccinated. And less than 4% of deaths were among those that were fully vaccinated. And this is against a backdrop in this particular age group where we know there was an inordinately high number of admissions and tragically deaths during the second wave. So, what it does tell us is in unambiguous terms that vaccines are having an impact. And if we can continue and ramp up the rate at which we vaccinate, we may be able to flatten the fourth wave into a non-wave, and that's what we all really are hoping for. So I think in this particular instance, I think the multiple sets of data that we do have available point in one singular direction, which is vaccines work to reduce infection, to reduce admissions, and most importantly, to reduce deaths amongst those who suffer with COVID.
It's an important point that you make there because, and this is the sad reality of the South African social situation, the private medical aids probably tell us a picture about the richer part of the population who can afford access to healthcare and maybe access to better medications and other options. But the public data typically shows us what's happening in the poor population. But we're seeing that the effect of the vaccine is the same. It's got nothing to do with how rich or poor you are or what access to other medical options. The vaccine itself is the thing that's effective. And then, of course, because we are all interacting with each other, again, the reality of South Africa, there's no rich compounds and poor compounds. We pass each other all the time in our businesses, in our streets, in our shopping malls. This vaccination is something we all have to take seriously. And if we do, it will have a benefit for all of us. That's what I'm seeing. Would you concur?
Yeah, absolutely. And, I think we should take our cue from our president on this one. Our president said that we are not safe until we are all safe. He has said that multiple times on local and international platforms. And I think it just drives home the message that COVID, while it affects individuals, has the impact to infect those around you. And so in some ways, and I've heard, local community leaders talk to their communities about the benefits of vaccines, not only as an individual protection, but almost as a gift, almost as a expression of the well-being of others, those around you, your families. And so if you care for those around you and your families, take the vaccine so that you could be protected from having the virus, from transmitting the virus, and encourage all of those around you to be vaccinated as well. And it does take us to something we may discuss a bit later, which is, even though we see that the data points in one direction in terms of the efficacy that the vaccine works, regardless of who you are, where you are, it has very high levels of protection against severe disease and death, is we are seeing in South Africa a differential uptake in different parts of the country, in different age groups, and even in terms of insured status or uninsured status, and that's something we can unpack a bit later.
Well, I mean, let's talk about that now, because I think that the vaccine uptake has slowed. I think it's been faster than many people thought it would be at the beginning of the year. But it's certainly not, I think, where we would like it to be. And I know that we've got enough vaccine. It's not as if the government has let us down and we haven't got supplies and things like that. The supplies are there, but it seems to me as if vaccine uptake is now slower. Is it all just hesitancy? Are we now pushing up against the anti-vaccine people, or are there other factors at play here?
No, that's an excellent question, Graeme. And I again want to pick up a cue from the Honourable Minister's briefing this morning, where essentially what he said is, in the next few hours, if not today, we will cross a very important threshold. 40% of all adult South Africans would have had a single dose. That's an enormous feat. Yeah. Yes, it's not 75% where we would like to be, but let's just pause for a second and look at 42 other countries on the continent, where most have hardly reached 5%, let alone 10%. And as you say, government has really done well to ensure that the freezers are full with vaccines. Whoever wants vaccines today can go to one of 3,000 sites across the country and get vaccinated. Also, the government has made it freely available at the point of service, and absolutely the medical aids and insurance have not only come to the party in terms of subsidizing the cost of those, but also providing the service provision around that. So I think that we have a lot to celebrate, firstly, and bearing in mind that this is the first of its kind adult vaccination program. It's actually a big deal. To have reached 40% in 6 months is a big deal. But your question around, there seems to be, slowing of uptake, and you're on the button on that, Graeme. So if we look across age bands, what we've consistently seen is that barring the 12 to 17-year-olds, which has just opened up, and this is that initial kind of spike in interest and engagement, for all other age bands, we've seen a tapering off and a very substantive tapering off in the groups we're most concerned about, those over 50 and those over 60. So much so that in those age groups, we're seeing less than 1% of the population being vaccinated per week.
Wow.
What that translates into is that it'll take us probably around 6 months more to reach our targets. And that's not okay, because that means we're going to hit the fourth wave, and that fourth wave could hit us really hard, and we could end up with an equal level of devastation. Now, if we unpack the data here, Graeme, and again, kudos to the South African researchers and academics who have just leaned in so much to try and unpack the epidemic, the response, the knowledge, attitudes, perceptions. Across 5 surveys that were done in South Africa, it's fairly consistent that between 2/3 and 75% of individuals are in fact ready to take the vaccine. Those are well-designed surveys, robust, have decent sample sizes. But your question is a good one, which is, but then how come we only have 40% of adults, having taken a single shot, and obviously even lower if we look at fully vaccinated? Now, there's an intention action gap over there, which is quite significant, probably in the order of 25 or 30%. So if we look at the data, and again, I think we must give praise where it's merited, and the South African government, its counterparts, its partners, have consistently tried to use data to inform decision making around the selection of vaccines, around the rollout program, and to understand the gaps. And so when we look at the South Africa's rollout program, what we have observed is a couple of things. If you look at vulnerability, the poorer individuals are, it is likely the harder it is for them to get to a vaccination site. And the socio-economic gradient for them to get to a vaccination site, get vaccinated, is significantly higher. So what do I mean by this? In the first few weeks of the program, we had the vaccine super keen across the country go to any site that was open, right? And so we had individuals drive 30, 40, 50, 100 kilometers to go to a site if they could afford to.
Yes.
Today, we have a situation where even 5 kilometers for some individuals, the opportunity and transactional cost for somebody to go there is simply too high. And so, Graeme, let me give you a real kind of story. When we went out into the field, and one of the things that, again, the South African government must be praised for in partnership with the Solidarity Fund, is a very intentional and precise focus on taking vaccines to people, is to take away the barrier of expecting people to find their way there, expecting them to endure the cost of transport, expecting them to make arrangements for their children who may be at home, when we know that everybody's really struggling financially and otherwise. And so we listened to an elderly lady standing in one of the grand queues where vaccines were set up at the SASSA queues. Makes so much sense. Go to where the people naturally congregate or meet or queue up for services. So whether it's the SASSA queue, whether it's the taxi rank, whether it's the retail store where people are already going, or amazingly, whether it's the voting station where some 12 or 13 million South Africans came out. When we asked the elderly people queuing for their social grant, where's the best place for you to be vaccinated? 78% of them told us, just here. It costs me nothing more, no more time, no more cost, and it's so convenient. And they shared with us the very real lived experiences of, if I'm only coming here to get 350 Rand as the COVID grant for the month, it's extremely hard for me to put away 80 Rand to take a taxi here and back, to give 50 Rand to a caregiver to look after my grandson while I'm there. Because that means half of my income for the month is gone. And so the more we can offset those user costs by either taking vaccines as close to people as possible, ideally outside their door, and potentially go door to door, or make it easy by going to where they are going, those outreach sites that we spoke about, that the Solidarity Fund is doing a wonderful job in funding, or as of 2 weeks ago, is offering a small incentive, 100 Rand voucher, especially for the elderly, especially for those who are struggling, to do some grocery shopping to get that done after the vaccination, is a small way that we can help individuals who are struggling with these barriers overcome those, so that as a nation we pull together. Because this is, as you started off, Graeme, this is not actually about us as the individual, but it's about how we as a collective come back to a normal state of functioning. And the best possible way to do that is for us to pull out all the stops and make sure that everyone that's struggling actually gets a fair opportunity at vaccination. And just to close off on this question, Graeme, because you mentioned, is this an anti-vax phenomenon? In fact, it seems as though if you compare South Africa to many other countries, the real proportion of anti-vax is a small and dwindling number, fortunately.
Yeah.
And so those individuals who are absolutely, dead set against the vaccine may, in the next few months, become a single-digit percentage of the overall, adult population. But I do think on this one point, what we can do is, for those who are a little bit undecided, and there is a group that's undecided, is do exactly what you're doing, Graeme, which is share the information. Be absolutely transparent. Be honest. Tell them what we do know, tell them what we don't know, so that they can make an informed decision. And we have found that that level of transparency gives people a reassurance. Warts and all, to be really honest about what we know about vaccines and what we don't. And fortunately, 18 months into an epidemic, we know a fair amount. Obviously, still learning lots, but I think we've got a lot going for us as a country, and I think we're gonna reach our targets.
No, I agree, and I would just add one extra thing to what you've said there, that another place that we could help people to get vaccines would be in our places of work. I speak a lot to business communities and business leaders, and to say, it's not good enough to just say to your staff, and especially if you've got a labor force and you've got workers who maybe don't have the additional money and they don't have the flexibility of their schedules to take a morning out and go to a vaccine site because they don't know how long they're going to have to wait. Luckily, they don't have to wait long, but people don't realize that these days. But as you say, even 50 Rand for a taxi for some people might be more than they can afford. So what business people can do is give vouchers, give a little bit of a pay for the taxi if that's the least you can do, give people some time off, or why not invite a nurse onto your site. I'm sure that it wouldn't take you more than half an hour to make a phone call and find out who's prepared to bring 100 vaccines onto your site. I'm not saying force anybody to do something they don't want to do, but give the opportunity. Just make it easy for people who might not find it as easy as you found it to get the vaccine.
Absolutely, Graeme, and you've given me a nice one to chew on here. So, there have been several very large employers, corporates, the mines, the banks, insurance, who have seen the value of this super early on in the epidemic. And when they heard there was a prospect of vaccines landing, they started moving around the chairs in the halls. They started setting up, and I know because I've seen some of this. And I think we need to acknowledge that leadership. I think those organizations saw early on that they would need to shift their business to accommodate for the vaccination program. And they've done this in weird and wonderful ways, and I've certainly seen that at the big organizations, but even at the small organizations. Graeme, I actually went through a list to understand which sites are setting up occupational health kind of stations for people to vaccinate. And Barry Kisnesamy at the National Department of Health, this has really been his big focus for a long time in partnership with B4SA and others to try and make this a reality. I want to tell you, Graeme, I mean, my background is in operations in healthcare, so I get really excited about super efficient models, right? Here's the deal. The most efficient vaccination operation we've seen, potentially even on the continent, comes out of a farming site in Garabou. And we're going to write this up as a case study, so watch the space. But what was amazing is, I think it was a apple packing or apple kind of, packaging facility. What they did was they worked with all the farms that were kind of supplying into the factory, and they created a schedule. So what the farmers would do is when they come and deliver their apples, or when the individuals that were picking up the stock to take out to the retailers, they would come with workers. So they created a schedule. They created a work plan that fit in so well because it meant that the farmer didn't have to set up their own operations, and they got kind of economies of scale. And they were going at rates that we double and triple checked. The bottom line is, Graeme, they did an enormously efficient operation out in the rural part of, the Western Cape.
Yeah.
And they said that this is a small contribution and we're going to do it. And so big business and small business can make an impact. And I think the other thing it does is when business does that kind of thing and shows that kind of leadership, it normalizes the behavior, it normalizes vaccination, it signals to the employee, we support you, we care about you. And so those small things that, we may see as small things like a couple of hours off at work, a free coffee, some transport, fee, actually goes an extra mile in, again, signaling to the employee, we care about you. We care about your wellness. Your wellness means the business wellness. And so it's an investment in you, with greater impact.
It strikes me that the decision-making about getting a vaccine is not a personal decision. It's one where, yes, I'm getting the vaccine to protect myself, but I'm also actually mainly getting it to protect the community in which I live, to protect myself from them and to protect them from me in case I do happen to get COVID. But the same thing applies to the economic decision-making about it as well. That if you are prepared as a business leader or business owner, maybe a community leader, maybe a church or a mosque or a temple leader, maybe that's a place to do it as well. But if you have a position of leadership somewhere in a community, it's the same mindset. You can say, well, I'm sorted, I got my vaccine, I hope everybody else is okay. Or you can put a little bit of extra effort in and just ask, what does this community need for those people who want to get vaccinated to go and get vaccinated? And just put a little bit, maybe slightly, I don't think it's a lot we're asking, but a little bit of extra effort into helping the community to get it done.
Yeah.
While I've got you, Dr. Brey, because I'm not a medical professional at all, I'm a scenario planner in a business. thinker. But I do have a question that maybe on behalf of people who are possibly just in that little hesitant camp a little bit, if you don't mind me asking you a quick medical aspect here. What's going on with all of the boosters? You know, people are now worried that we're going to have a third and a fourth and a fifth. How many boosters do we need? Does it mean the vaccine's not working? I know I get a flu shot every year. I'm not even sure I know what the question is, but just can you help us while
Sure.
I've got you to understand what's going on here?
So, Graeme, this is certainly, you know, one of those areas where our understanding of the immunology is kind of maturing as we learn more. But when the clinical trials were done, we knew for certain that the vaccines would give us strong protection against severe disease and death for a duration, whether that was 6 months or whether that was 12 months. What we've learned as the vaccination programs rolled out over the world and more research is being done is that there's kind of a waning immunity. And I want to break that down into very simple terms. So basically, you know, if we think about the vaccination, we get the shot, it builds up an army in the body. If after 14 days, there's 1,000 soldiers in the body ready to kind of, you know, take on COVID, what we see over time is that it becomes 700, 500, 400. And so increasingly, what researchers are looking at is at what point does it make sense to then give a booster, you know, give additional soldiers so that the body remains protected. And this is, you know, I think folks could say, is that not a failed, you know, tool? Actually, it's if one considers the potential impact of not having vaccinated several 100 million individuals, we probably would be in a world where the COVID death toll had more than doubled by this stage. And so it was the best tool that we had at the time. And the evolving science is offering us another option, which is a booster shot. And so it's not as though we've, you know, completely like missed the boat on this one and given something, firstly, that's harmed anyone or harmed, you know, a number of people. And secondly, we still have lots of options. So, you know, we could provide a host of boosters. I think it's plausible that eventually what we will see is that, just like you said, you'll have your flu shot because you know it protects you against severe disease, hospitalization, and death. Hopefully it'll be a combined shot. You know, you have your flu COVID shot and it's done. At this point, we don't know. I think there's a lot of research going on into how that will work. But I want to be really clear on the message here that booster shots are not, you know, a failed instrument. It's that the science has told us that for certain individuals, they will benefit from having more soldiers on board because it will provide them continued protection. And that we do have the tools. So, for example, right now as we speak, South Africa has 30 million vaccinations in the freezer. Fortunately, we don't have a supply shortage, you know. So, and the last point to make, Graeme, is vaccinations are still better, booster shots are still better than taking your chances with natural infection. Because this is a question we commonly get, which is, you know, shouldn't I just take my chance with natural infection? And I think it's the equivalent of running across a 4-lane highway blindfolded. I lost a cousin my age with absolutely no comorbidities. I've lost so many family members that I kind of stopped counting. And I know that everyone watching this program has at least known or lost someone in their close circle.
I have
We
to.
actually have an option. We have an option to change that trajectory here and now. And vaccines are one of the ways we can do that.
Quick follow-up question. Does natural immunity, I think that's the right label, in other words, people who have had COVID and recovered, would their antibodies also become less over time? So you maybe had COVID last year, you've recovered, now you should consider getting the vaccine because, again, your army of soldiers has also diminished. Is that true?
Absolutely, absolutely. We know individuals that have had COVID in every wave.
Yes.
Every single wave they've had COVID.
Oh, the same individual just gets it again and
absolutely,
again.
They got COVID 3 times.
Yes.
I mean, my own GP got infected twice, and in the second wave was hospitalized with severe COVID.
Wow. Yeah.
So, and the other thing to understand about natural immunity, it's variable in the sense that some people could get protection for 3 months, some could get it for 3 weeks. We don't really know. We don't know what drives that. Whereas with vaccines, there's a bit more predictability. We still don't know, not everybody will get exactly the same immune response, but there's kind of more predictability around what the duration of protection is going to be, whether it's 6 months or 12 months, etc. And I guess it's just this question around when nobody in South Africa has died from taking a vaccine, will you really take your chances knowing that you could die from natural COVID infection?
My answer is no. For me personally, other people must make their own decisions. Thank you, Dr. Brey, for your time. Before you go, I want to invite you into my world. I do scenario planning. Nobody can predict the future, but we can look for patterns. We can see trends. We can make informed decisions. The 4th wave, so-called, a number of months ago, there were lots of predictions. People were really nervous that when we got back into December, January again, we might be seeing a 4th wave. Has vaccinations maybe reduced that risk? What do you see if I ask you to look ahead for the next few months? And are you bold enough to tell us what 2022 might look like and when we might get back to normal?
Oh, sure, Graeme. I mean, I don't know that I have the confidence of a crystal ball on COVID. I'm keen to meet the person that does, because every time we say something, we get proven wrong, right? And so, like, approaching this with a big pinch of humility. But let's say a couple of things. I think we must acknowledge that the rate of emergence of variants has been a curveball. And so, Delta Plus, etc., have kind of, caught us a little bit by surprise because they're so much more transmissible, etc. If we have a variant that emerges between now and January, that is fundamentally different, uses a different method of attack, is far more transmissible, I think we should expect a surge in infections. Even amongst...
Dr. Brey, can I pause you there, because this goes back to the point we're having this conversation. The best way to make sure there isn't a variant is that we stop the disease transferring from one person to another, because that's when a variant happens, right? When it transfers from one person to the other. So stopping the disease spreading is the most important thing to do, and vaccinations is the most powerful tool we've got to make that happen. Now, can I just interrupt you and just make that point? Yeah.
Super clear. You've said it better than me, Graeme. I don't think you're going to need me for another interview. I think you're spot on the money on this one. And absolutely, it's going to... Vaccines will change the trajectory of the epidemic, full stop.
Yeah.
So the variant, as you say, because we have such differential rates of vaccination, across the world, across the continent, and even in South Africa. There are districts, Graeme, that have really poor coverage, and there are districts that have very good coverage. And so, we should bear that in mind. I think the second piece is actually related to vaccination, which is the higher the rate of vaccination, the higher the level of protection as a general population, as a community. Now, we did think that maybe that number would be closer to 70%. It's actually going to be a bit higher. We wanted to be, and again, praise to government for increasing its target for the elderly. That's now been increased to 85%. So that's where government's going to stop with its vaccination program for the elderly, and I think it's absolutely the right thing to do. So the higher the rates of vaccination by the end of the year, by January, the less the likelihood that we have a severe fourth wave. And that's based squarely on the data, that we shared with you earlier, which is unambiguous, that most people being infected, getting into hospital, and dying are the unvaccinated. The third thing is, even as our vaccination rates increase, and even, and as we head into the holiday season, I think we still have to take all of those other precautions. And our colleague, Kerrigan, Professor McCarthy from the NICD, framed it really well by acknowledging that after a tough 2 years, people do want to have a bit of a celebration. Completely understandable. Let's just do that safely. Let's not do what some other countries did, which was open massive events without precautions. Drop social distancing as a measure, drop masks when we don't know what's lurking in our own environment and what's coming in from other countries. Now, we can't isolate ourselves as a country. Our tourism industry needs this. And so the things we can do in terms of NPIs is hold on to them a little bit longer. I really think that, again, like the leadership here, take us past the fourth wave with NPIs, and hopefully, that'll have a big impact. And Graeme, I mean, our hope, as we wrote in an article a few weeks ago, is that if we do all of those things, the only wave we really want to be talking about in December are the waves at the beach, nothing else.
That's a wonderful place to finish this conversation. Zameer, Dr. Brey, I really appreciate your time. Thank you for speaking to me. I hope people have taken the time to listen to this conversation and take the simple message away. For yourself, for your family, for your community, the best thing that you can do is to get vaccinated. And the second best thing that you can do is to help other people get vaccinated. And that's our best path to getting back to normal. We don't know when that will happen, but we know what the best path is to get there, however long it takes us. So, Dr. Brey, thank you for your time, and thank you for the work that you've been doing during this pandemic, and I'm sure the work you plan to do ahead to get us out the far end. Thank you.
Thanks, Graeme. Thanks for the opportunity, and wish your listeners and your viewers, hopefully a restful, safe period over the next few months, and hopefully we don't need any more of these, is my wish.
Thank you. If you're still watching, I really appreciate you taking the time out to watch that interview. I hope you got as much out of it as I did. We really do need to roll up our sleeves, SA, and get vaccinated today. I'm supporting that campaign by the Solidarity Fund. Dr. Zameer referenced them a few times. It's the way that we get our economy going again. It's the way that we are able to confidently and safely connect with family and friends over the upcoming holiday season. And it's absolutely the best tool that we've got to make sure that 2022 we see the economy growing, we see businesses growing, and we see our country getting back to, again, if normal is the right word, I don't know, but building itself up again after these really rough 2 years that we've had. So once again, roll up your sleeves, SA. Get vaccinated today.